Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name's Sandy and I'm the Executive Officer of the Association and a cancer survivor.
And my name is Malcolm, Chairman of the Isle of Man Anti-Cancer Association and a former surgeon. In this podcast we want to talk about tumours that affect the eye. Sight is something that many of us take for granted and only really appreciate how important vision is when we find ourselves struggling to see properly. Most of us will have learnt about the mechanics of our eyesight during our education and have since become accustomed to visits to opticians to have our eyes checked on regular occasions. Many of us will have had to get used to having to wear glasses as we get older. Like a number of other important organs, we are fortunate to possess two eyes at birth.
Each eye is contained within a socket in the front of the skull, giving it a degree of protection from external trauma, with a lid that can close over the cornea at its front and sweep across it to clear of any particulate matter. It's surrounded by the eye muscles, responsible for its movements, and periorbital fat to cushion it. Light entering it is focused onto the retina, with the impulses created passing out of the back of the eye, along the optic nerve, to create images within the back of our brains.
Tumours affecting the eye are rare, with only around 850 cases a year in the UK, which is one or so annually on the island. There are a number of different tumours that can arise in and around the eye, the common ones being eye melanoma, squamous carcinoma, lymphoma, and retinoblastoma. Occasionally, a tumour which arises in another part of the body, such as the lung or breast, can spread or metastasise to the eye.
Retinoblastoma is a tumour that develops from the immature cells in the fetus that create the lining of the back of the eye. It affects around 36 children under the age of 5 years in the UK every year. Both eyes may be affected, and in nearly a half, a faulty gene can be detected on a blood test. If one of the parents has had retinoblastoma as a child, then any offspring should be monitored closely. An affected child may appear to have a white glow at the centre of their pupil, or may have a squint or a slightly reddened eye. Any parent concerned about a young child's eyes should get them seen by their doctor and refer to an ophthalmologist.
The commonest tumour to affect the eye is a form of malignant melanoma, often called an ocular or uvular melanoma. A number of areas within the eye contain melanoma cells identical to the pigment cells in our skin. These tumours tend to occur in individuals over 50 years of age, and just as with our skin, exposure to intense sunlight is a risk factor, particularly in those who have lighter eye colour or fair skin.
Squamous cell carcinoma can arise from the corneal covering of the front of the eye or from areas of skin surrounding the eye. Other extremely rare tumours arise from other cells found within most of our organs, including our eye, such as immune cells, which can give rise to lymphomas.
Symptoms associated with tumours affecting the eye are varied and somewhat dependent on the area affected by the tumour. These symptoms may include bulging or change in appearance of the eye, change in sight in one eye, either blurring, blinkered vision with loss of peripheral vision, or partial or even complete loss of sight in the eye, seeing spots or flashes of light or wiggly lines in front of your eyes, a dark spot on the coloured part of your eye, known as the iris, which is getting bigger, a raised lump on the surface of the eyelid or around the eye irritation, red eye, or chronic conjunctivitis. Or you may get pain in or around the eye, although this is rare with eye cancer.
Although this seems a long list of possible symptoms, in the majority of cases, the problem you may have with your eyes will far more likely to be due to a condition that is not cancerous. Most people would quite rightly, as you should with an eye problem, go and see your doctor or an ophthalmologist and be referred on to a specialist if they feel there is a problem. Outcomes from eye cancer are good, as most individuals do present early. And remember, treatment these days does not necessarily require loss of the eye.
The message that we want to get across is that if you have a problem with your eye, it is very unlikely to be due to a tumour. However, as eyesight is so important in our everyday life, if you notice anything that is not right for you, get it checked out by your doctor. For more information on eye tumours, visit cancerresearchuk.org or Macmillan or on the Isle of Man, visit the Macmillan Cancer Information Centre in the entrance of the hospital, or you can call them on 650 735. Thank you for listening.